So this is week 3, the skills blog, where we're supposed to talk about leadership models in nursing and models of care and nursing management. And one of the ways we were supposed to do this was by analyzing our own system and our own healthcare unit, and by filling out a leadership questionnaire, and then taking the results and analyzing how we would function as a leader or a manager in our own unit. So the healthcare model that is in place at my place of work is a vertical model, although it was really interesting to do the reading because we're actually undergoing a flattening process right now. They are eliminating different CODs, and just as it said in the actual reading, we're calling our nurse managers to have more responsibility to make up for the fewer CODs above them. So now all of our CODs have more and more departments to manage, or more units within departments to manage, and the nurse managers are having to pick up extra responsibility. So there is a flattening going on, but it is definitely a bureaucratic vertical model where we report to our senior officer and they report to someone above them, and the hierarchy gets smaller and smaller as you go higher and higher. One of the things that really stuck out to me, that didn't surprise me that much about the leadership questionnaire, was that I am highly, highly interpersonal and not very administrative. I was higher than I expected. I got a 22, but that was nothing compared to the 27 I got in interpersonal. And I was not at all conceptual. That's not at all me. But it's interesting because that actually plays into my style of nurse managing and how I think I would function as a nurse manager, although God help me, I don't ever want to be a nurse manager. So I found that in Chapter 7, the model of directing made the most sense to me, and I think it actually correlates with my preference towards interpersonal management, because if you look at the reading and when it talks about directing, it's a function of the manager who gets work done through other people, which actually sounds really lazy at first, but I think that what they're trying to say is that you accomplish what you're trying to accomplish by motivating others. And it's through giving direction, through supervising, leading, motivating, and communicating, and I think those are all very strong interpersonal traits. Another question that was asked in the prompt is, how would you use published literature in the process of managing? And I think a good example of that is actually the article that I pulled, which you can find in the reference I listed, and I also attached the article to the blog. And it's an article about palliative care in Canada and how they actually changed their palliative care model to shift palliative and hospice care out of hospitals and into a home setting or an outpatient setting, and the problems that they ran into and the struggles that they faced. Some of the things that I pulled from the article that I thought were most relevant to the blog and most interesting included how the plan was, the goal of the study that the article focused on was to integrate palliative care in the healthcare setting, and to use the multidisciplinary team to shift palliative care and hospice care outpatient while still maintaining the same level of quality care for the patients. And how this worked well, but it worked very differently depending on the model of care that was being used, because the different facilities they brought together all functioned under different models of care. So just bringing together the different styles of management and leadership and the different models of care used in the different healthcare settings was in itself a challenge. The team utilized in this particular article included medical doctor, nurses who specialized in palliative care and hospice, social work, and bereavement teams. So those were the highlighted players, but actually I'm sure there are other people involved, because anyone involved in comfort and hospice and dying, there's definitely more people than that. The common goal that they stated was shifting care towards patients and away from the healthcare team, so that we got the focus off self, I think is how they quoted it, and back on the patient, to focus on what was most important for the patient. And that was to have a comfortable and pain-free death in a comfortable setting, which was why this project started to begin with, and how to best accomplish that. And through this common goal, they were able to shift towards the interdisciplinary team and create cooperation between facilities of integrated care. One of the things that it brought out was not only did they have to learn to work with one another, and the interdisciplinary teams had to work together, nurses with doctors, doctors with bereavement teams, social work with the nurses, but they also found that as they became more reliant on one another, they had to become more reliant on outside sources and other advocates, such as the hospital and the PR team and the HR team and administrative to support their cause. This relates to the next question, which is what levels and departments would you need to work with if you were a manager? And we actually deal with a lot of hospice and palliative care on my unit, and so it really helped me think about it, that we work very closely already with all the ancillary services, lab, respiratory, physical therapy, occupational therapy. But when it comes to death and dying, we also work very close with our chaplaincy service, and we have actually a really wonderful team of volunteers that comes and will sit with anyone who is on palliative care who doesn't have family. We have a lot of resources for recreation and therapy and music and art therapy, and so these are all people that we pull in to achieve that goal of providing a calm, peaceful, pain-free death. And I believe that pretty much covers everything that was the prompt for the blog. But the last thing was, would you prefer a vertical or horizontal leadership? And I think that I would probably prefer horizontal, with interpersonal style being my preference. I think horizontal style facilities and healthcare units allow more for interdisciplinary teamwork and for interpersonal leadership styles, because it is not so hierarchical, which is, I think, the word that best describes the vertical style. And we're approaching 7 minutes, so I'm going to stop talking.